Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a review or rating on Apple or Spotify. It only takes a moment and it really helps the show reach more lost families. Today's episode is all about the importance of sleep, both in general and more specifically towards women who are trying to get pregnant, going through pregnancy, or going through the grief of infertility or loss. So for today's grief tip, it is to make sure you are sleeping. It sounds so simple, right? But when we're in the midst of our grief and when we're going through the hard times, we don't always make sure that our basic needs, such as getting enough sleep, are being met. Your body cannot heal and restore itself if you aren't getting enough sleep or rest. As you will hear in the interview today, Dr. Darley has some great tips to help if you are having trouble sleeping. Today's business spotlight comes from Mackenzie about her project called Books from Gwen. Here is what Mackenzie had to share.
Hello, my name is Mackenzie. I became a lost mom last spring. My daughter Gwendolyn Isabella was born with a congenital heart defect called tetralogy of Fallot. After receiving her diagnosis at 12 hours old, she was sent on an ambulance ride to UCSF Benioff Children's Hospital in San Francisco. At 5 days old, she underwent open heart surgery. However, the doctors were never able to get her to stabilize off of life support. After several more unsuccessful procedures, we made the excruciating decision to remove her from life support at 5 weeks, 1 day old. During her time in hospital, Gwen was hooked up to machines, so we had limited ways to physically care for her. One of our only ways to bond with her was to read. We read to her every night, and we learned how reading can bond families together during complex hospitalizations. During this time, we received many care packages, but missing from them were books. At Gwen's funeral, we requested that people bring children's books in lieu of cards. We were amazed by the outpouring of support at her funeral. We were able to donate 1,000 books to UCSF Children's Hospital in San Francisco in her memory. Then, in October, we donated another 400 books to UCSF Children's Hospital in Oakland. We have also received countless used books, which we have donated to a local nonprofit that supports children facing medical diagnoses, various daycares, an elementary school, and dozens of little free libraries. I am proud and humbled by the support and connections I've built in my community. This project has been a wonderful way to honor my daughter's memory and connect with her in her physical absence. We are always welcoming used and new books and are planning to open a little free library of our own. If you would like to follow our journey, you can find us on Facebook and Instagram at Books from Gwen. Thank you so much for letting me share our story.
Thank you so much, Mackenzie, for sharing your beautiful project with us. Today, I am talking with Dr. Catherine Darley. She is a naturopathic physician who specializes in sleep. Dr. Darley talks about the importance of sleep, especially for women, during all stages of their life, including trying to get pregnant, pregnancy, and after pregnancy. She also experienced 3 miscarriages during her motherhood journey. Hello, everyone. Today I am here with Dr. Catherine Darley. Can you tell us a little bit about yourself?
Yeah, so I'm a naturopathic physician and I specialize exclusively in sleep and have throughout my whole career. I like to help people of all ages and particularly women and families. Sleep is so important. It's the foundation for how we are able to function and show up in the world.
What is it that got you interested in sleep?
I have always been a good sleeper, Sarah, and the times that I don't get enough sleep, I really feel it. And that helps me know how very important it is. And there's actually some research that after 3 nights of not getting adequate sleep, you lose sensitivity to how impaired you are. But I don't usually get to that 3-day mark. And so I feel the sleep deprivation.
I think that's kind of something I've dealt with too, especially having a baby who doesn't like to sleep. I definitely can see how, after the multiple days that it would just stack up and you'd have, bigger effects on your life that you may not even like realize that you're having.
Yes, right. It's kind of your baseline of what your normal performance is adjusts down, and you think, oh, this is what's normal for me, where you lose sight of how well you were functioning when you were well rested.
Yeah. So you always hear like, okay, you need 8 hours of sleep. Is that actually what you need?
Yeah, so it's a bell curve between 7 and 9 hours. And I think what's really useful is to think about it that your sleep amount that's perfect for you is something that is a quality given to you, like your eye color or any other physical feature, that we don't choose it, it's just given to us. And you could graph that out on a bell curve and see, more blue-eyed people, less green-eyed people, etc. And so think about, where do I fall on that bell curve? For myself, I'm like 8.25 hours, 8.25 hours is my ideal amount of sleep. A couple ways to help people identify how much sleep they do best with is to know, first of all, if you're waking up to an alarm, either a physical alarm or you use your phone alarm, that is a sign that you have not gotten enough sleep. Hands down, that is a novel idea for a lot of people. So if you are waking up to an alarm, one strategy is to increase your total sleep time by 15 minutes every 3 or 4 hours, or excuse me, every 3 or 4 nights until you're waking up before your alarm. The other clue that you're not getting enough sleep is if you're sleeping more on days off. If you're sleeping more on days off, that's probably closer to the amount of rest that you need on a regular daily basis. And, one of the questions that comes up, one of the follow-up questions that usually comes up is, well, can you catch up on your sleep? And you can't really catch up on your sleep. You have lost those days in terms of your mental performance, your health, your relationships, all of that. And it's, think about it like food. Would we think, oh, it's okay to eat only, 2/3 of the calories we need to function well, and then we're just going to feast on the weekends? No, that doesn't make sense. And it doesn't make sense for sleep either.
That's really interesting. I never thought of it in terms of like if you're waking up to the alarm that you didn't get enough sleep. Like you should, I guess, ideally be awake before that, then. Is that what you're saying?
Yeah, it's just it means you're cutting your sleep short if you're using the alarm.
Yeah, I definitely have to drag myself out of bed in the morning to that alarm. So yeah, that's kind of
Yeah,
tough for me. So
I think most people.
I know briefly, I know you mentioned that you dealt with pregnancy loss as well. Do you mind like just briefly
Yeah,
about
yeah.
that?
So I I waited until I was 32 to get pregnant because I was doing medical school, and then I was surprised at the 14th week, I started having pregnancy-induced hypertension. And so I was advised to not open my business, which actually the phone call with that information came the day before I was going to sign a lease to open my medical practice.
Oh, wow.
Um, yeah, so that was really abruptly life-changing. And I was supposed to lay on my left side as much as possible for the next 5 months. And then at week 35, I developed preeclampsia, and we just had to get the baby out of there because my liver and kidneys were starting to struggle. So that was my one and only child. And then we decided that I wouldn't start my business. We would just try to have our children maybe a little bit closer together. So I had 3 pregnancies that all resulted in miscarriages, and it was very heartbreaking at the time, and just the rapid hormone changes to go from not pregnant to pregnant to not pregnant to pregnant. That was hard. It was a period of So between the time my daughter was 1 and not even 3, we had 3 miscarriages, and all of those pregnancies went till about the 11th, 13th week. So it wasn't super early miscarriages. And I did all of the testing and whatnot, and no cause was ever found, which I think a lot of people experience that, where there's no cause found. And in some ways that is harder, in some ways maybe that's easier, I don't know. But yeah, it was definitely a life altering experience. I always wanted to have 3 or 4 children, and so yeah, I'm sad about that.
Oh, I'm so sorry for your losses. Yeah,
Thank you.
I mean, definitely life-changing for you just in not having the family that you envisioned, but then also, also changing your business and your timeline for that. And it has so many like far-reaching consequences.
Oh, it totally does. And now my daughter's 20, and I think a mother's love is just so expansive. At least that's the way I experience it. So, life is good, but it definitely was a hardship, and it does still have a ripple effect. I'd love for her to have siblings. It shapes our relationship just so much more intense, because she's the only kid and I'm the parent. And so if she wants to play a game, I'm it. I mean,
Right.
especially in the pandemic, she was a teenager. And so we have a very close relationship. And I think that's a blessing. But I think about when I'm gone, and, she doesn't have any siblings. So
Yeah, it's a lot to think about.
it's a lot to think about. Yeah.
So I know,
So
oh, go ahead.
go ahead.
I was just going to say, I know you mentioned, dealing with the hormonal changes of, being pregnant, not being pregnant, So do hormones play a big role in sleep?
They do. They do play a big role in sleep. And we see this during pregnancy. We see this for women throughout the lifespan. And really, actually, starting with menarche, when women start having their menstrual periods, in their early teens or 11, 10 years old, they start having more sleep complaints than the men their age or the boys their age. And we see that really throughout the lifespan. Um, During pregnancy, there are changes at each trimester.
Is it true that I've kind of heard conflicting information, but is it true that women actually do need more sleep than men? Or is it just depending on
Um,
what you were saying earlier about?
Women yeah, women tend to have a little bit longer sleep than men. And that is true pretty much throughout the lifespan. Women also tend to have more sleep complaints. They're more likely to notice things that aren't right with their sleep, or just feel the disruption, or uh, sensitive, I would say, to sleep complaints more than men are.
So you mentioned, having different sleep needs like during each trimester of pregnancy. Like what, is there some that require more sleep or how are those changes?
Yeah. So how about I walk us through kind of a little bit of the sleep changes of each trimester? Would that be helpful?
Yes, that's perfect.
Yeah. So in the first trimester, women will often feel much more fatigued and need more sleep. Just this abrupt changes that the body starts going through with pregnancy. More fatigue, needing more hours of sleep. That's the primary change. And then in the second trimester, women will generally feel a little bit less fatigued. Their body will start, the baby's growing even larger at that point, and the woman's body is starting to change. And so women may start having more aches and pains, just kind of depending on how their body is changing. They may also start to have difficulties maintaining their iron. Those will translate into a couple sleep complaints. One is just physically being comfortable. We want women, particularly as they enter the third trimester, to be sleeping on their left side. That's the best blood flow for the baby. And then having a pillow, a body pillow, or sometimes there's these C-shaped pillows that women can sleep with, where you have a pillow between the knees to help the pelvis be in neutral alignment, maybe a pillow under the belly to really support it so a woman can be on her side and not sleeping on the belly. And then the pillow can go underneath the upper arm and underneath the head. That can be really good just to keep neutral spinal alignment during sleep. Then you also want to think about the iron, because it will increase the risk of what's called restless leg syndrome. In restless leg syndrome, what happens is a person will feel like they just have to move their legs, or they may feel tactile sensation like ants walking on their skin or something of that nature. And it's worse in the evening. It's better with movement. It's related to iron status. So the rate of restless leg syndrome increases in pregnancy, peaking in that third trimester. And then over the lifespan, it also increases in women. It's about over 50% of women who are postmenopausal have restless leg syndrome, actually. So that is something to watch out for. And for that, you can go to your primary care physician. They'll have usually nutrient treatments that address that restless leg syndrome. The other thing, I know I'm giving kind of a long answer here. The other thing I want to mention, though, Sarah, is that through the pregnancy, as women gain water weight and edema, we can also get edema in our airway, and that's going to increase the risk of obstructive sleep apnea, which is when the airway collapses for 10 seconds or so at a time and blood oxygen level drops a bit. So untreated obstructive sleep apnea is actually associated with lower APGAR scores when the baby is first born. In those first minutes, there's this test that babies are given just to kind of check their alertness. And when mothers have untreated obstructive sleep apnea, the baby's APGAR score in those first minutes of life are not as high. So that's something to know about. And if you have a bed partner who says, your snoring is so much worse now that you're pregnant, might be something to get checked, and you want to treat that during pregnancy if it is obstructive sleep apnea.
That's a lot of really great information, though, that I had no idea that the restless legs was related to iron, because I did deal with that during my pregnancy. Like, I just couldn't get comfortable. I had to keep like moving them, like no matter which way I laid, like they were just uncomfortable. So it's good to know that, for people who are dealing with that they can go get that checked.
Yes, yes.
Now, what about sleep when you're going through things like fertility treatment, like when you have extra hormones, and does that affect that quality of sleep?
It can, and I wouldn't say that we have the full story yet on all of the implications. There is a little bit of research showing a connection between good quality sleep and adequate sleep and success of IVF treatments. So that's something to consider. There's also a strong relationship between our circadian system and our health and our reproductive health. The circadian system is that 24-hour variability or pattern, I should say, in our function. And it's really dependent, it's really because human beings evolved on a rhythmic earth with bright days and dark nights. And the reproductive system also has some circadian features that we want to strengthen for health by being connected to the natural light dark cycle, getting outside light during the day, having really dark nights, so that our melatonin production can be high at night. There is a role of melatonin in our reproductive system, so we want to have our natural melatonin really functioning well.
Are there some ways that you can help like boost that melatonin naturally?
It's more about removing the things that suppress it. So melatonin production is suppressed by bright light, and many homes are too bright in the evening or too bright during sleep hours. So these are the recommendations that for 3 hours before bed, you are in light that is 10 lux or less. So that's spelled LUX. It's 1 lux is equal to 1 candle flame. So 10 lux is like 10 candle flames. And you actually on your phone, you can download a free lux meter and then test it out, which is actually kind of fun if you're
That sounds
like
cool. I'll have to try that.
sciencey. So the recommendation 3 hours before bed, 10 lux or less. I think at 3 hours before bed, most of us are still really in an active part of our day. So if you can't dim the lights and get it that dark in your home, an alternative is that you wear blue blocking glasses, and these make everything just a lovely sunset hue, and they will block the light so that your natural melatonin can start to rise. Melatonin has many actions in the body. It helps us feel sleepy, and that's what usually people associate with. But melatonin actually goes throughout our body. All of our cells have melatonin receptors. So when we have this burst of melatonin created in the brain at night, it actually goes throughout our body and signals to our entire body. It is nighttime, time to sleep, time to rest and switch into that restorative physiology. So then the other challenge that people have is that during sleep hours, your bedroom should be only 1 lux or less. A really easy way to test that, Sarah, is if you hold your hand out, if you can see your fingers wiggling, that is too much light. You want it to be really dark in the night. One thing that we see in pregnancy is that the majority of births happen during night, and it's because melatonin has a role in our reproductive system and actually helps with the labor process to go smoothly, and that's why more babies are born at night than during the day. So yeah, lots of reasons to make sure that you are getting darkness and dim light at the right time for your melatonin to surge.
That's really interesting. I actually went into labor with two of mine. My water broke overnight, and I was like, why are they being born like in the middle of the night? So that's interesting to know the reason behind that.
Yeah, yeah.
So how do you deal with, trying to get enough sleep when like you have a newborn at home, when you're up, waking up every 2 hours, and they always say like sleep when the baby sleeps, but that's not always possible. So do you have any tips for that?
Yeah, so I do have some tips. One is again getting back to lighting. Of course, you need to have enough light to care for your child, but you also want to not suppress your own melatonin and not suppress the child's melatonin. At about 6 months is when children start to make their own melatonin, and so they need to have right light conditions to be able to do so. So I'm a big fan of people not having a nightlight on constantly. Have by the adult bed a light that can easily be turned on when you're needed. When your baby calls out, you have a light that's just there, easy to turn on, but still fairly dim, light enough for safety, but not any brighter than that. And then if your baby's in another room, have again a light that is enough for doing what you need to do, but it's not giving any more light than that. And ideally a light, instead of maybe using the overhead light, which is going to shine on your eyes and into the baby's eyes if you're doing a diaper change or whatnot, to have a light that maybe is on a table so it shines um, onto you at the waist height or the chest height, but not onto the eyes. It's really the eyes that we want to protect from getting that direct light. And also using light bulbs that are more yellowish hue than the bright blue or white light, full spectrum lights. Those are to be avoided at night. And then with babies, most of babies in human history have not slept with a light on. And so I am not a fan of having a night light on in the baby's room all night. They don't need it. And it's going to suppress their melatonin, potentially, particularly if it has a blue pattern to it. Yeah.
So when you're not like putting it in the baby's room, do they just get used then to sleeping in the dark, or will they still maybe need one when they're older, or does it just depend, I guess?
They'll just get used to sleeping in the dark. That's the conditions human beings have slept in most of human history, and it's fine for them. And I've had some clients, some patients who have come in, families with grade school children, and the grade school children want to do sleepovers, but they're so reliant on having the nightlight that they can't do sleepovers because the place they're going to sleep over doesn't have a nightlight on. And it definitely suppresses melatonin, and you don't want to do that. There's a relationship between melatonin and aging. You want your melatonin levels to stay high and healthy throughout the whole lifespan. I know it's controversial. People are
It
so
is.
used to sleeping with nightlights.
Yeah, it's one of those things that I guess if you're doing it from the beginning, then it's good. But if you start out that way, then it's kind of harder to break them from it.
Right. Yeah. And if that's the case, I would do things like first switch from a blue to a dimmer yellowish nightlight. That's going to suppress the melatonin less. And then you could do something like have it on at the wind down routine, but turn it off when it's actually time to close the eyes and the parent's leaving the room. Do something like that so it's more gradual can be helpful.
Do you think that the sound machines are helpful at all, or are those kind of disruptive too?
I think that if the household is really still active, you've got people of different ages and on different schedules, it may be needed if a child can't fall asleep due to the sound. But I wouldn't introduce a noise machine until a child says, I'm not able to sleep because it's too loud. Because children, their sleep drive, their circadian rhythm, it all is like so much better than adults that kids can often sleep through anything. When actually I'm reminded when I was 5, the house next door burned down to the ground and I slept through it.
Oh,
Yeah.
wow.
I mean, I'm sure that was quite loud with sirens and fire trucks and commotion, but yeah, I slept through it.
You were tired, right?
I know. Yeah.
So what about things like the melatonin supplements? Like, what do you think about those?
Definitely not for children. Children's melatonin is very, very high compared to adult melatonin. During puberty, melatonin drops by about 30–40% down to adult levels. There are a few medical conditions in children that melatonin is recommended for, those being autism and attention deficit hyperactivity disorder. But outside of that, children do not have a melatonin deficiency. The recommendation from the American Sleep Association is to have children do behavioral and lifestyle approaches to improve their sleep before melatonin is used. Unfortunately, there's been a few cases of children poisoning themselves by taking too much melatonin. That's happened in the last couple years. So there's been an advisory put out that melatonin should not be just taken off the shelf and given without a medical guidance. And, for adults, I think for people who are over 50, because our melatonin levels do decline significantly at that point, possibly taking a low dose is helpful long-term for its anti-aging, anti-inflammatory, antioxidant properties, but not on a long-standing basis before that.
So it's really kind of one of those case by case things, really. Kind of depends on the
Yeah.
person.
Right. And the thing about melatonin is that there are 58 sleep disorders total.
Oh, wow.
And melatonin is a treatment for only a handful of them. And I think sometimes people have a sleep problem, but they don't know necessarily what it is, but they just know I'm not sleeping well. And I've heard about melatonin or a friend's taking melatonin. And so they try it, but it's not addressing the cause of their sleep problem. And then that doesn't work.
I didn't realize there were so many different sleep disorders. You hear about kind of the main few.
Right. I know. Some of them, of course, are rare.
So how would people go about, finding out what the cause of their sleep issues are?
I think a great place to start is with your primary care provider. And then there are sleep centers at most major hospitals, and those are staffed by sleep specialists. So that may be, a good place to go if you know that you have obstructive sleep apnea because your bed partner says, your breathing pauses and I'm just counting the seconds until you start breathing again. That you could take yourself directly to a sleep specialist. Or if you have something that's really, really quite kind of seems strange, some sleep behavior that seems really strange, that maybe is one of those rare sleep disorders that your primary care physician may not be well equipped to deal with. There's also another specialty called behavioral sleep medicine specialists, and you can find them at behavioralsleep.org. They are great for insomnia, for shift work, for other types of sleep problems that have a behavioral treatment. And sometimes they're easier to get into and get an appointment with. You can find providers in your area at that website.
So since you mentioned insomnia, I know that's a common pregnancy complaint. Is pregnancy insomnia, is that something that can be treated the same way as like regular insomnia, or is this just kind of a separate thing?
No, it can be treated. Well, the recommended first line treatment for insomnia is called cognitive behavioral therapy for insomnia. And it's kind of it's a strategy that you get guided through, and it has some behavioral changes and some counseling aspects. And that is great for women who are pregnant and having insomnia because it's not going to have any drugs associated. Women shouldn't be taking sleep medications when they're pregnant. And it is very, very effective.
And what about like shifting just a little bit, what about like when you have gone through a loss and you're going through all of this grief and all of these emotions, and obviously that can really affect your sleep quality as well. So is there anything that you would recommend for that?
Yeah, I think that is a time to really, be gentle on yourself, and hopefully you have a good support system who's also acknowledging just the emotions and the loss and grief and whatnot. Um, my, um, my thought on that is, and really whenever anybody is dealing with a loss or a stressor, is to think about time in two different chunks, that you have your wakeful hours, and that's when you deal with stuff. And that from the time the lights are out until you wake up in the morning, that it's kind of time out of time, and that you're not working on responsibilities or processing, that it is really time just to restore, and you're purposefully giving yourself permission to take a break from it. Just like any big effort that we're doing, it's appropriate to take a break at times and just step away from it. And I think if you can kind of carve out, okay, this sleep time, I'm just going to rest and set down this burden of processing the loss and the grief, is a good strategy. I know, of course, it's not easy. It's easier said than done, but adopting that attitude that I'm going to give myself a break from this hard stuff during my sleep hours, and to facilitate that, to have a routine of doing a brain dump an hour or so before bed, where you just write down the thoughts that tend to come up at night, the worries or the whatever comes up at night, you park it on the paper until the next day. And then in the night, if your mind starts going, you tell yourself, okay, I already thought about that. I'm going to have time tomorrow. Now is my time to rest. And we all know that when you rest, you come back to something with better energy, sometimes better insights, right? And just in a calmer place. And I think that is a great strategy. And then to do some kind of sleep promoting activity, like do progressive muscle relaxation. Get into bed, you put your thoughts aside, get into bed and do progressive muscle relaxation, where you're tightening your feet tight as possible, count of 7, let them relax, fall heavy in the bed, work slowly on up the body, or recite. One of my strategies that I love is to think about a sweet story that could be a book, a movie, and just start at the beginning and just kind of recite the story to yourself. Something that is interesting enough to kind of follow, but doesn't have any hooks in it, doesn't get your emotions or your thoughts going, just something kind of to focus on as you're falling to sleep.
I love those ideas, and I think a lot of them would be super helpful. I actually deal with anxiety, and so a lot of those sound like they'd also be really great for dealing with anxiety, which tends to kind of come up at night when I'm laying there, like thinking about everything.
Right. Yeah. I think that we have we do have so many responsibilities as mothers and women. And, sometimes getting into bed is the first time we have quiet and can think without people needing our attention. And, better to take that quiet time outside of bed, so that you don't start associating your bed as someplace to be awake and to be thinking those thoughts.
Yes, kind of building on that, I find that, yeah, when I lay down at night, that's like the first time I have time to like myself, and then I end up staying up too late because I'm enjoying the time to myself. So yeah, it's definitely a
Right.
struggle.
Yes, I think that happens a lot. Bedtime procrastination, right?
And then you're like, uh-oh, like it's late now. I should have already been asleep.
Yeah, I've experienced that myself. And yeah, with teenagers, my daughter, it seems like even when she was visiting over the recent holiday break, she's going strong at like 8 or 9 and coming alive and having so much stuff to talk about with me and share her days and college life and whatnot. And I'm like yawning and I'm thinking, oh, this is usually the time I'd be going to sleep, but it's our chance to connect. And I reminded her, and she said, oh, I remember that in her high school years, I said, I have to have an hour to myself before bedtime. And we can talk up until this time, but then like, I have to have like a little wind down time to myself. I don't know. I mean, we certainly didn't do it all the time, but that was something I knew everything would go better if I could have that little bit of time.
And it's good to be able to set that boundary because so many of us, especially as women, are really bad at setting boundaries for, especially for things that we need.
Yeah, right. Like I said, I wasn't perfect about it, but she says she remembers me telling her that in high school. And I am glad. I think that, it seems like people are talking about boundaries and acknowledging them more so now than maybe 5 years or even 3 years ago. And I think about sleep is a good place to set some boundaries that you're going to get the sleep that you need so that you can be at your best self during the day.
I mean, it seems like really we need to be treating sleep just as important as like diet, exercise, things like that. But especially as moms, it seems like, sleep is a luxury almost. It's not like a basic need, even though it is.
Right. It totally is. And I think about it in 5 domains that sleep impacts our physical health and our mental health. So, you mentioned anxiety. Anxiety is definitely worse when people are sleep deprived. And then it's your cognitive performance and physical performance. So, if you're a mom and you're driving carpool, you need to have good sleep so that you can be safe for everyone in the car. Attention is much better, reaction time is much better when you're well rested. And then the last piece that is a growing area of understanding and just really important is emotional intelligence and your ability to relate to others is much better when you are well rested. Your sensitivity, like if I come in to the home and I see my family member and I'm sleep deprived, I'm not going to be able to tell in that first glance if my family member is happy or angry. And think about how many times we walk into a room, we see our child and we know like what is going on with them. No word has been spoken. It's been literally like 3 seconds, but we know. The thing is, if you're sleep deprived, you're not going to know as well, and you're not going to be able to be responsive to their experience like you want to be.
So is there any other like tips or advice you have about, sleep in general for women who are trying to be mothers? I mean, I know it's kind of a broad range, but just general advice you have to give.
Yeah, so the process of having a good night's sleep starts when you wake up. There are 5 time points that, excuse me, are very important for setting your circadian system, and your circadian system being robust improves your sleep. So you want to get 20 minutes of bright outdoor light as soon in the morning as you can, ideally within the first 2 hours of the day. And then you want to continue getting bursts of outdoor light every 2 hours, 10 minutes every 2 hours. And we're supposed to be getting up and taking a stretch break anyway. So 10 minutes of light every 2 hours, the 3 hours or 2 hours before bed using the blue blocking glasses. That's going to be important, and turning down the lights in our homes, having that dark bedroom. And then having meal times at the same time every day actually helps synchronize all of the systems within your body so that they're working at the same time. We have this master circadian system in our brain that's sensitive to the light and the darkness, but then all of the clocks in the organs, those are synchronized more by the time we eat our meals. So having meals within a 30-minute window across all days of the week makes a big difference.
See, and these are things like I don't even really think about on a normal basis because it's, you're just like go, 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 like you're just so busy that it's like eat when I can, do the, and but the routine and the consistency I can see are really, really important.
Yes. Yeah, they make a bigger difference than people realize.
I mean, we talk about setting routines for kids, but we don't like set the routines for ourselves.
Yes.
So, if people wanted to find more information about you, where would they go for that?
So I have some online courses around sleep at skilledsleeper.com. I have one that is specifically for women, and there's a unit on the reproductive years, pregnancy, the menopausal transition, senior years, and what to do at all of those stages to boost your sleep. Unit on sleep disorders. And then if you're interested in social media, if you're on social media, I'm on Instagram. I have a YouTube channel. I have a Substack, trying to meet people at their different interest levels. And those are all under Skilled Sleeper.
Well, I want to thank you so much for coming on today and sharing all of your advice about sleep. I definitely learned so much that I didn't even know.
Great. Thank you, everyone. I'm so glad to be here.
Thank you so much, Dr. Darley, for all of this amazing information. It made me realize that so many things I thought I knew about sleep were not accurate at all. I know I will definitely be making some changes based on our conversation. And like many of us are guilty of, I know I need to go to bed earlier instead of staying up too late scrolling on my phone. Hopefully we can all find some better ways to get time to ourselves. And I hope you all learned some tips to help improve your sleep quality as well. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a review or rating on Apple or Spotify. It only takes a moment and really helps the show reach more lost families. Thank you so much for tuning in, and remember, we are all in this together.